So what I'm going to do today is, we've got someone new here. Hang on. Is to talk about the brain. And looking at it is quite a big topic, understandably. So one thing that I think is very prevalent and interesting to people is the link between brain health and how can I mute from? When you come in, here we go. Oh, I've muted everyone. Here we go. Okay. So what I was saying is when we look at the brain, there are various risks in your DNA report that talks about your risk of Alzheimer's and also other forms of dementia. And I don't know a lot about things like Lewy body dementia and different forms of dementia. If that's come up for you, those ones I'm not aware of the research into those. You would need to have a look and speak to the genetic counsellor that you can access through your DNA report. So anything that comes up in terms of disease risk, whether that is things like dementia or anything in relation to cancer risk or inherited genetic disorders that you can pass on, through the app, at the bottom of the app, you can actually book a call with a genetic counsellor who has the up-to-date research on those things. But one area that is of interest to me and has been really well studied recently and is the subject of a lot of ongoing research is the link between Alzheimer's, because that's one of the most genetic forms of dementia that's being studied at the moment and really what causes it. And there is an interplay between the genes that affect your dementia or Alzheimer's risk alongside those that affect your cardiovascular risk. So there is an interplay there, and that's what we're going to look at today. Separately, we'll also look at optimizing brain health and the type of things that you can use to really get yourself switched on, and the type of supplements particularly that you can use and the type of nutrition that you can use that really helps you perform cognitively at your best. So that's something that we'll look at separately because it was too big a topic to put into one presentation today. And then for those of you that are interested, I will be one of the calls we're going to use to go through hormone replacement therapy. So I can outline for you the latest research on that, the interaction with the brain, when is a good time to speak to your doctor about starting it, when might be a bit too late, if it is too late, and really just the interaction between estrogen and hormonal therapy and the brain. So we know that the brain goes through a reorganization around the time of perimenopause and menopause, which it should recover from, given the right situation. And there is a storm of other things that are going on, and depending on how much you're looking after your health will determine to a degree how bad your menopause symptoms are. So if you can bear in mind that the way I very much see menopause is that it is a magnifying glass of what is going on in your body. So if you're getting extreme menopausal symptoms, that is often a sign that there are issues within your body that you need to target, whether that is blood sugar or insulin sensitivity, whether that is inflammation, whether you are at higher risk of, whether you're maybe put on too much weight, or you're verging on the obese category, for example. These are all big drivers if your stress levels are too high. And so we know that people that later develop dementia, often menopause is a triggering event. And the symptoms that are diagnosed, when dementia actually gets diagnosed 20 years or so later, we know that it's decades before that some of these things have begun to happen. And so really, you want to see menopause as an opportunity because it's actually shining a light on where you need to look. But we will do a separate presentation for those of you that are interested. I think a couple of people in the chat that are interested in what to speak to their doctor about in terms of hormone therapy, what the different options are, and how that can impact you and what might be the right time to do it. But what I would say to you is, at the moment, one of the things to bear in mind, and if you haven't listened to it and you are still in your menstruating years, and you're thinking or have been taking or are taking the birth control pill, then I would definitely go and listen to my podcast with Dr. Sarah E. Hill, which is the one on your brain on birth control, because it dramatically affects it. If you have yourself have teenage or young daughters, young adults, have a listen to that podcast, because what's clear after reading her book and listening to the podcast that I did, or the conversation I had with her, is that the birth control pill does affect the brain in a different way to antidepressants, for example. So, and it changes the brain, it seems, and this is again is emerging research, over the longer term. And so when birth control is prescribed in perimenopause, that is something that you may prefer, and you would need to discuss it with your doctor. I'm not a medical doctor, to resist the prescription for, because once you've listened to that, it will give you some insights. And it's definitely made me think long and hard about whether I would be, the conversations I would be having with my own daughter around the birth control pill. And this is coming from somebody who took it and was prescribed it from the age of 15 for PCOS, took it for literally many years, and did then suffer terribly, as you know, with depression. And there seems to be a link between your risk for depression after using the birth control for years and pregnancy. So there's a lot of things that come into play here. But if you can understand that there are estrogen receptors all over the body, and so it's affecting cardiovascular health, but it's also affecting the health of the brain. And that's a really important point to understand. But I think what's better is, rather than us talking about that today, because it's kind of a topic on its own, is that we talk about hormones and replacement therapy and the interaction with menopause as a separate one. And I'll share with you some of the studies, really, because I'm not a medical doctor, as you know, but it will give you the information that I think you need to take to a doctor to make an informed choice as around whether or not you do get hormone replacement therapy, and also the other things that you can do from a holistic point of view and a nutritional and a lifestyle point of view that will very much support any hormone replacement therapy that you get or are having, because it isn't it's not a magic pill. And I think a lot of people expect it to be. It isn't a magic pill. So it's one of those situations where if you're doing all of the lifestyle stuff and you're having hormone replacement therapy, the outcomes and the way that you're going to feel are going to be drastically different. But what you'll see in the presentation that I'm going to show you now is, for men and for women, a lot of the things that are risky or predisposes you to a greater risk of things like dementia and Alzheimer's are things that come in middle age, but just seem to become much more prevalent for women post-menopause. And they're things that need fixing and that are regularly problematic in our current society in the Western world, which are things like inflammation, blood sugar instability. And that's why dementia is being labelled quite often, more commonly now, as diabetes 3, because of the impact that blood glucose dysregulation, metabolic syndrome, which is where you usually have problems regulating your blood glucose, with central obesity, basically, so abdominal fat significantly, and also inflammation in the body. And those things do raise your risk. So does lack of sleep. So what I'm going to show you, if that's okay with everyone, is we'll go through the APOE gene, and then in a couple of weeks' time, we'll revisit with the hormones, because I think next week we're going to go over the whole of the genetic report again, because I think for those of you that are new and have your DNA reports, that will be a really good overview for you. And then for those of you that are coming to the end, it will be a really nice recap of everything that you've gone through, and then we'll do a separate one on hormones. So what I'm going to do is I'm going to share with you my slides here, if I can get my screen here over, and just explain to you some of the things that you want to be thinking about. Just see what's in the chat. Yeah, okay, so just a few people saying you'd like more insight. So hopefully you can see this. Yeah. So essentially, where you're going to be looking on your report is you'll see under here dementia and brain health. So this is my risk, moderate risk, which is the middle category, which means that I have one copy of APOE4, and that predisposes me to a greater risk of Alzheimer's dementia. The most neutral one, APOE2, seems to be protective against Alzheimer's. The most neutral one that most people have is APOE3, and that doesn't seem to have a huge impact. If you have one copy of APOE4, it can increase your risk, and you'll see here about 3 times higher. And it explains to you what Alzheimer's disease is and how it begins in the nerve cells of the brain, where these deposits of protein called plaques and tangles appear in and around neurons. And these plaques are made of a protein called beta amyloid, and the tangles are made of another protein called tau proteins. So you get this amyloid plaque and these tau proteins built up in the brain. The reason that sleep is so important, and I talk about it so much, is that part of what happens while you're asleep is that your brain effectively cleanses itself through the glymphatic system. And this is about 10 times more active at night, which is why sleep is so important. Now, you'll see on some of your genetic reports that it says that you are someone who genetically needs less than 7 hours sleep. What I would say to you is, when you look at the scientific literature on sleep, as you start to go sub 6 hours, you are putting yourself at a much greater risk. So you wouldn't want to, when they say sub 7 hours, that might be that you're someone that actually manages perfectly well on 6.5 hours. And in fact, there was a very large study that was done on the amount of sleep and the healthiest people in the world. And it was such an enormous study that they couldn't compute it for many years until the technology had moved on for them to be able to understand the data. And when they did understand it, they found that the optimal time for sleep was 6.5 hours. And I don't think that's because that's so optimal, but because those people that were sleeping 6.5 hours were so healthy. They fell within that category. So when you're looking at your sleep, you do want to be looking at your genetics and thinking, am I somebody who's over 9 hours? Am I 7 to 9 hours? Am I sub 7 hours? But then you need to be factoring in how well are you sleeping? So what's the quality of that sleep? And we know that the best devices really for checking that out at home are the Whoop and the Aura and the BioStrat, for example, but you want ones that are measuring blood flow and blood volume rather than these kind of wrist ones that are basically looking at movement, because they're estimating how many steps you're doing, they're estimating how well you're sleeping. And even the Aura Ring will not be that accurate, but at least it's giving you data on yourself. So you want to look at the quality of that to make sure you're getting sufficient deep sleep, which is when a lot of this cleansing and repair goes on. And also looking at your REM sleep, which is also really important, and your overall sleep. But then what will also affect that is how much stress are you under in your day-to-day life? How much are you exercising? Because exercising is causing stress on the body. It's then in turn making you more resilient and stronger, but you have to be able to recover from what you've done. So if you're exercising and you've broken down muscle tissue, you're going to need more sleep. So you want to look at your genetics and then factor in everything around it and think, what's my overall load? And so you may find that there are certain periods in your life where you need much more sleep and other periods when you need less. What we do see is that as people tend to get older, they sleep, they struggle to sleep as long and as deeply. And that's why sleep hygiene becomes so important, because we do want to really activate this system and make sure that the brain is cleaning itself. And it would be a bit like, some doctors would compare this to, if your brain isn't doing this cleanup every day, it would be a bit like you having a dinner party, inviting a whole ton of people round, and then when you wake up in the morning and that night that you didn't clear up the kitchen and you come down and it's a mess and you're just like, oh my God, I can't believe I did this, why did I not do it even though it was 3 o'clock in the morning? If you then had another party a few days later and then it got added and then another party, this is how disorganized and how much the brain can begin to suffer by you just layering on. It's almost like an assault when you're not getting enough sleep. So it's so important. So with the sleep, when you're looking at your DNA report, and we'll go over this again in next week's presentation when we look at the overall report as a whole, just factor in everything that you're doing and how much you've got going on. If you've been sick, you've had COVID recently, you're going to be needing lots more sleep because your body is trying to repair. And so I would encourage you to give into that. What you can do when you have the luxury of doing so is not set an alarm and actually see how that what your natural sleep time and wake time is without an alarm, to actually get a really good idea of how much sleep you're needing. But just be aware that if you do have one or two copies of APOE4, it does seem to predispose you to a higher risk. However, Dr. Dale Bredesen, who's done a lot of the research on this, he wrote a really good book called The End of Alzheimer's. In this presentation, I've included the main points that he makes in terms of how you can protect against it. And he has a recode protocol that he has used to actually at least moderate the implication of Alzheimer's, and in some cases reverse in people who are kind of very early stage and have these other things like inflammation and metabolic disease going on. And he does see it as a real risk. You can then look at people like Lisa Mosconi, who's done a lot of work on the XX brain, the female brain, and the interplay with that between hitting sort of perimenopause and menopause. And she sees it as a little bit more lifestyle related. So they all have different opinions. And that's why I say to you, it is very emerging research. But what the good news is, what it looks like, is that this could be largely prevented within the next decade or two, given what we know. And then there's exciting studies in rodents going on where they're looking at things like lion's mane, which help to enhance nerve growth factor in the brain, and that helps with the connection of neurons. But sleep is definitely something. So according to Dale Bredesen, APOE33 gives you around a 9% risk. APOE34 gives you a 30% risk, which is about 75 million Americans. And then there's a small category of people who fall into a 4-4. This doesn't mean that you will ever get it. I should say that. This doesn't mean that you will ever get it, because everything that you do lifestyle-wise to protect yourself is important. And even things like your level of academic qualifications, how much you're using your brain in your life, make a huge difference to what's going on. Exercise makes a massive difference to the health of your brain. And so understanding that movement is like, if exercise was a pill, everyone would take it. And actually now they're trying to create a pill that mimics exercise, but it's so important. So the reason that APOE4 seems to be such a risk factor is because it reduces the clearance of these amyloid beta peptides that are forming in the brain and then binds to DNA. This gene is also linked to cardiovascular disease and inflammation. So there is a correlation between dementia and cardiovascular disease. But it also shuts down the gene that makes SIRT1, which is a longevity gene, and it's associated with activating one of these pro-inflammatory nuclear factors as well. And then there are lots of genes that limit inflammation, and it seems to stop some of these activating. Now, one of the markers that you can look at that doctors don't often measure is called homocysteine, and this is a marker of inflammation in the body, but it gives you an idea of how well your methylation pathway is working and whether you are at greater risk of cardiovascular disease. So this is something you can check. It's increased when you don't have enough nutritional support. So if you look at your genetic report and you also see that you're someone that has an increased need for B vitamins, then I would definitely encourage you, and you can do simple at-home tests for this, or you can work with someone like myself to have a look and see what are your folate levels, what's your B12, what's your B6, and the ones that are really affecting these pathways. Homocysteine, we do get lots of foods containing methionine, in particular muscle meats do. That's why you want to have other things like bone broth and other things that contain glycine and balance out the methionine. But you also want to make sure that this methionine doesn't get stuck as homocysteine and gets reconverted. And for that, you do need B vitamins. So as I say, you want to look at B6, B12 and folate. So have a look at your DNA needs, and then betaine is also important. So you can get betaine from beetroot, from broccoli, from spinach and shellfish, and then especially if you sprout and ferment grains to make them more bioavailable, you can get betaine as well. But if this recycling system is impaired and it kind of goes in a circle like a loop, then what happens is you can get homocysteine buildup, and that homocysteine can damage blood vessels, and there's an interplay with the brain as well. And specifically, it can contribute to atrophy, so a shrinkage of the hippocampus. And the hippocampus is the part of your brain that's involved in learning and memory. And so you'll see as one of those early symptoms that people start to forget what they were talking about. They don't quite remember why they went into a room. Now, some of this is normal, right? Some of this happens as part of, I say normal, I should say common, and this happens as part of hormonal imbalances. So anyone that was pregnant, me included here, 3 times, remembers pregnancy brain, where you just can't remember. And I remember being at work and having to write everything down, and I couldn't remember it unless I did, and then it comes back afterwards. Very similar during menopause. But during menopause, you want to make sure, and when I say menopause, I mean perimenopause, because menopause is one day in your life, which is the day that marks 12 months after your last period. But that whole perimenopausal period and postmenopause, that sort of almost 10, 12, it can be up to 12 years, you really want to make sure that you are exercising, you are taking care of your sleep, you are managing your stress levels and doing all these lifestyle things, because actually this is what can really, really set you up for a better second half of your life. These vitamins are really important. Vitamin E is also important because it's an antioxidant and it helps to protect cell membranes. These are the forms of, if you're looking at supplements that you would want, so P5P is a good form of B6 that's available. B6, importantly, affects your melatonin production, so it will impact sleep, which is important, and that has a knock-on effect on your ability to clear these plaques. So, and tau proteins. So you want to make sure you have enough B6. That will help you methylate serotonin into melatonin. B12 is really important. Often I see people who've actually got quite high levels of B12 because they've been taking it on its own sublingually. And so you may not need to supplement with this all the time. And that's why I say it's best to test, not guess. And then methylfolate. And there is, I think it's Lactobacillus plantarum as well, which is a probiotic that you can take, which actually helps your gut bacteria produce, help you produce more folate as well. And folate is really, really important in pregnancy, which we know from the risk of things like spina bifida as well. Now, insulin resistance, this is important. So high insulin resistance and high glucose are 2 factors that they've identified, and this is often why dementia is being called type 3 diabetes. So you could have high blood sugar, but be managing it where you're producing enough insulin that your blood sugar keeps being brought back down. And that will happen for so long until eventually your cells basically get to the point where they've kind of had enough. And so insulin is knocking on that door to go into the cell, and the cells aren't listening. And so what happens is the pancreas has got to produce yet more insulin to knock louder and ask to be let in. And so these are 2 really important factors that need to be controlled if you want to protect yourself against Alzheimer's. If you have got insulin resistance, you're more vulnerable to type 2 diabetes. That's kind of the next stage on for many people, and also fatty liver, because your liver will start to accumulate more fat cells as well, because the liver can only store a very small amount of glucose. So you probably remember from previous presentations me saying how you can store glucose in your liver and you can store it in your muscle tissue. So to improve insulin resistance, we want to be training our muscles. That's why resistance training is such an important part of longevity. Whether you're doing that through some really intense yoga sessions, whether you're doing it through body weight, whether you're following the resistance exercises that we give you on the program, just understand that a few times a week you do need to be incorporating resistance training as part of your longevity plan. And it also contributes to Alzheimer's disease. So you can check and your doctor can do this easily, your fasting insulin, your fasting glucose, and your HbA1c is a guide of what's been happening over around the last 10 weeks or so in terms of how sugary you've been, if you like. But now it's super easy as well to get a continuous blood glucose monitor. That's going to be a much better way of you seeing the spikes and troughs, so that intraday variability, and it will hold, the continuous blood glucose monitors hold data for 8 hours. So it's a really easy at-home way of you actually seeing what's going on and in real time being able to control the foods that you're eating, because you can look at it and go, wow, you know, when I have this food, my blood sugar shoots up massively, whereas when I compare different things together, I get a more stable response. And generally any protein and fat is going to moderate that glucose response. Every time you're having an unopposed carb, it's going to shoot up much more quickly. Inflammation's important as well, so you can measure this. CRP is one that doctors test very, very commonly. It's produced in the liver in response to inflammation. You'd also see this go up if you had an infection. So it's not a very good guide of telling you where or what's wrong, but it tells you that there is something wrong. And so you want to have this as low really as you possibly can. You can look at these other ratios of these proteins, albumin to globulin, and then also your ratio of omega-6 to 3. So we talked about this previously. If you're having lots of seed oils in your diet, or you have been, you've had lots of fast food, processed food, and your omega-6 is much higher, and you haven't got enough omega-3 to balance it out in your red blood cells, that predisposes you to higher levels of inflammation. And again, these at-home tests you can get, I think they're harder to get in places like Germany in my experience, but certainly I think in North America and in the UK, it's pretty easy to order these tests and check out what your omega-6-3 ratio is, so you can see. And if it's looking high, you can reduce the omega-6 fats in your diet and then really increase the omega-3 and use supplementation. These are harder to check, IL-6 and TNF-alpha. You have to have pretty advanced testing. I did have these checked recently. I was part of a study for a longevity test where they were looking at inflammation as a marker for longevity. And that's something that's gaining a lot more research at the moment, is whether inflammation could be predicting how quickly you're aging. So inflammation is one, and also looking at methylation tags. Again, these could be up for a variety of reasons. We see these inflammatory cytokines go up in COVID, for example. But in terms of really like good actionable points, what I would say to you is make sure you're getting enough B vitamins in your diet. Make sure that you supplement if you need to with B vitamins, but also look at vitamin D, because vitamin D is really key. So it travels through your body kind of like a Wi-Fi signal in your cells. And it binds to vitamin D receptor, which is, we look at the vitamin D receptor genes, and that's what allows it to enter into the nucleus. And when it does that, it can turn on over 900 genes. So it's really important. It's important for immunity, not just from viral infections, but for protecting you against things like cancer as well. But importantly, it also turns on genes that are essential for creating and maintaining brain synapses. So it's really worth having replete levels of vitamin D. Your report will tell you whether you're at an increased need for vitamin D. So some people will find that if they're in increased need of vitamin D in their report, even in the summer with sufficient exposure, you're not manufacturing or synthesizing enough vitamin D. So in that situation, you need to supplement. And then for a lot of people in the Northern Hemisphere, like most people on this call are, we do need to supplement during the winter. I actually tested mine last winter. I didn't supplement at all. And by April, I was still replete, but I was spending a lot of time outside, even with skin exposed in the winter, and it's very difficult to synthesize it. I'd got really good stores in the summer, and I hadn't kind of lowered them. And I was having things like oily fish, eggs, which can help, but it's difficult to get enough for your diet. So for most people, you do need to supplement, and you can have a kind of maintenance unit dose, for example, of say 1,000 units or 400 IU or up to 1,000 IU a day. But really, if you start to test it, then you can dose, and I'll show you a calculation that will help you find out how much vitamin D you have and how much you might need to take. But vitamin D is made when sunlight basically takes cholesterol. It's a cholesterol molecule called 7-dehydrocholesterol and converts it into the active form of vitamin D. And to absorb vitamin D, if you're supplementing with it, you've got to have fats. It's a fat-soluble vitamin. So there's no point in taking your vitamin D on an empty stomach. You want to take it with a fat-containing food. The ones I like are like the droppers that you can put under the tongue and take it sublingually, and they're usually in a lipid base. And you can take it with K2, which helps with calcium as well. This is a calculation. So Dr. Dale Bredesen does believe in having really robust levels of vitamin D in terms of his research in relation to Alzheimer's, and he uses this calculation. So if you measure your vitamin D3 through your blood serum, you can then dose where you want to get to by 100. So for example, now this is different. It's measured differently in the UK. So this actually would be a lot higher in the UK. I think it's like 75. I've got it in a minute. But essentially, in the US measurement, 30 nanograms per milliliter. If you wanted to get to 80, and he likes most people to be between 50 and 80 in terms of protection, then you would subtract your goal level from your current level, which would give you a gap of 50, and times it by 100 to get it in international units. And that would tell you what the international units you want to dose with are. And you can get these droppers that dose it in 1,000 international units, and then you can just put however many drops you need to. In the UK, so a 30 ng per mil is actually 75 nanomoles per litre in the UK. So they're quite different. But it's really about, speaking to your doctor. Often doctors will be happy with a lower level, but you want to kind of get it up to the higher levels, but don't go over. Some people I've seen are really going, like they're taking so much vitamin D. And again, like anything, it will become toxic at very high doses. The other thing to bear in mind is your copper to zinc ratio. There has been some association between having too little zinc with dementia. And copper and zinc compete with each other, and often copper will take priority, which is why you can end up deficient in zinc with too much copper, because they are so competitive with each other. So you might be getting extra copper if you're using copper pans. There's some copper in vitamin supplements. You might have copper pipes that you're drinking from. The other thing is you might be less good at absorbing zinc because the stomach basically produces less acid. As we get older, we tend to have less acid production. And just as we need good stomach acid to digest protein, we also need good stomach acid to absorb zinc. So that's quite important. If you have low zinc levels, interestingly, you're more sensitive to toxins like mercury and mycotoxins from mold. So zinc is really important. It's really important for immunity. It's one of the supplements that's been really well studied by the Functional Medicine Institute. If you have COVID, making sure that you're getting kind of 60 milligrams a day of zinc. It enhances cognition. The other thing is when they're competing at receptor sites or to go into cells between copper and zinc, zinc is complete and it does have paired electrons. Copper is incomplete, which means that when you think about how oxidative stress happens in the body, it's when cells have unpaired electrons. Electrons like to go around with their body in pairs. And so if you have an unpaired electron, that cell is going to go and look to take an electron from another cell. And that creates like a chain reaction of oxidative stress. That's one of the main reasons that we eat high antioxidant diet with lots and lots of plant-based foods, because those colorful foods have loads of antioxidants, which means they have lots of electrons to donate. So that's why you want to, and you'll be able to see on your DNA report again, whether you are somebody that has a raised antioxidant need. And if you have a raised antioxidant need, it suggests that you're not as good at producing key antioxidants that our body produces, like glutathione, like superoxide dismutase, like catalase. And so you want to be going and getting more antioxidants from your diet to compensate from this. So that can be the headline antioxidants like vitamin A, vitamin C, but also the polyphenols that we see in foods and all these micronutrients. We want to be getting those, and those actually donate. So copper can, if it's unopposed and you haven't got enough zinc, it can cause an issue. And they reckon, how many people are in the world now? Is it about 7 billion? 2 billion people are estimated to be deficient in zinc. So zinc is a big one that a lot of people aren't thinking about. And this has been associated with dementia. It's also been associated with decreased insulin synthesis, storage and release. So again, if you're someone that is struggling a bit with insulin resistance, making sure you've got enough zinc is important. You can just take like an easy supplement form like zinc picolinate, for example. It can lead to increased levels of autoantibodies. So if you're struggling with autoimmunity, it can lead to increased inflammation. It can lead to oxidative stress, as I've just spoken about, which can impact aging, and reduced hormonal signaling as well. And actually, interestingly, if you look at zinc and its interplay with hormones, if you're someone that's been struggling with things like acne, for example, taking zinc often actually helps to calm that down, among other things that you need to do. It can lead to reduced neurotransmitter signaling, and it can make you more sensitive to toxins. So you can measure your copper, free copper and zinc in red blood cells. Most people don't necessarily need to do this. What I would say to you is making sure that you have good vitamin and mineral status by incorporating all the foods that we talk about in your diet, but also taking a multivitamin and mineral supplement is a good idea. The other things to look at are magnesium and selenium in terms of minerals. So magnesium is critical for brain function. It's another one that people are often really commonly deficient in. And certain forms of magnesium, if you are struggling to sleep, particularly in perimenopause, will help you. So the two that you would look at often are magnesium glycinate, is really helpful, or magnesium threonate. And magnesium threonate has been shown to really help with brain function as well. And so this is where we're attaching, magnesium being attached to an amino acid. So magnesium glycinate is attached to glycine. So both of those are good. You can measure magnesium, it has to be measured in red blood cells. But selenium is also important because selenium is important for thyroid function, but it also works alongside glutathione to mop up free radicals. So with selenium, most people can get this actually from Brazil nuts really easily. If you're somebody that doesn't have a nut allergy, just having like 3 Brazil nuts a day will pretty much eat your selenium needs. So it's something I just incorporate every day as part of my diet. Low glutathione can contribute to inflammation, toxicity, and this loss of connection. So what we call synaptic support, the connection between neurons. Now, glutathione, you can take liposomal glutathione. You can also do the things that, as some of you have already had presentations on, we'll be going through again, is to incorporate foods that assist with that. So sulfur-containing foods are really important. Vitamin C is really important. Taking something like N-acetylcysteine is helpful because that's often the limiting factor in glutathione production is cysteine. And so taking NAC can also help you produce more glutathione. Selenium is also key to regenerating glutathione. So again, making sure you're getting those Brazil nuts in is important. And then with heavy metals, sorry, just want to check where we are on time. Heavy metals such as mercury and neurotoxic. So you want to be limiting your exposure to mercury. One of the biggest sources of exposure to mercury is from large fish. Because it accumulates as you go up the food chain. So if you're having smaller omega-3 rich fish, you'll be exposing yourself to less mercury. So you can use the acronym SMASH to help guide you. So SMASH is sardines, mackerel, anchovies, salmon, and herrings. Those are all fish that tend to be high in omega-3 and low in mercury. Mercury fillings is a massive area on its own, and dentistry is a huge issue. Seeing your dentist is important because it's a really big indicator of what your health as a whole is looking like. They can be complex to get removed. You can find biological dentists. I did a podcast with, trying to remember, who was it now that I did the podcast with? But it was a really good podcast with a biological dentist. And he has an amazing Instagram account. If you ever want to find out the toxicity of teeth, you can just go and look at his Toxic Tuesdays. His name will come back to me in a moment. But he does this Toxic Tuesday, and the unbelievable things that he removes, and people's root canals that have gone wrong, and they're causing systemic problems all across the body, and how he rectifies them through the mouth. Dr. Kelly Blodgett, that's who it is. If you have a look at Dr. Kelly Blodgett, I did a podcast with him, but have a look at his Instagram account. You get mercury actually deposits in the bone, the brain, and other tissues. Urine tends to be a better test for looking at mercury, but I would say it's difficult to get rid of. Things like sauna help you detoxify these, particularly like infrared saunas. You can do Quicksilver Scientific, also do another test that you can use to test for mercury toxicity, and it looks at hair, urine, and blood. So it looks at various different ones. Arsenic can affect the executive functioning of your brain, so you want to kind of stay away from that. There are ways that you can wash rice, for example, to reduce arsenic exposure, where you kind of rinse it not just before cooking, but after as well. You always want to buy the highest quality you can on this, but that can affect mental acuity, verbal fluency, depression, and HPA access. The other things that can affect your risk or have been associated with forms of dementia is actually having depression. That's one. Traumatic brain injury is another one, because it can deprive the brain. of oxygen and important nutrients. So whether you've had a traumatic brain injury, red light therapy is really good for helping with TBIs, but overall you want to really reduce that inflammation. And then lead, obviously that's less of an issue now, everything's really regulated in relation to this, but in children that were exposed to lead paints and things, they ended up with a lower IQ, so it can impair cognitive function. Cadmium is found, you can get it from car fumes, chemical factory exposure, and also cigarettes. I would say that top of the list in terms of longevity of not exposing yourself to is cigarette smoke. It is still literally the single best thing you can do for your health is to not smoke and not be around people who do smoke. It's the biggest impactor of longevity still in terms of reducing it. And then hormones, thyroid function. If you see a doctor that specializes in dementia, they will sometimes look at your thyroid function, just because the thyroid can affect the brain and cause cognitive processing issues. If it's not functioning optimally, it can show some cognitive impairment, and it's not dementia, it's to do with thyroid function. UTI infections that women are unaware they've had can sometimes cause impairments in cognitive function, and they need to be fixed. Estrogen and progesterone, we'll go into that in a separate presentation and how that causes brain fog and poor memory. Testosterone is really, really important. That supports the survival of neurons. Both men and women have testosterone. Obviously, it's usually higher, significantly higher in men, but we both need it. Cortisol, pregnenolone, and DHEA are all really important. And one of the things that I look at when I'm looking at a client's Dutch test, so Dutch is the dried urine test that you can do. It's nothing to do with being Dutch. It's not a location thing. But this is a really good way of measuring the metabolites of hormones. And what I often do with clients is I look at their urine as well as their saliva to see what their cortisol awakening response is. And from the Dutch test, we can actually tell whether they've got good levels of melatonin. We can see whether organic acids are building up in their body, and if they are, in response to deficiencies in vitamin B6, which, as you know, affects sleep, and melatonin, whether they've got deficiencies in B12 and B9. We can see adrenaline and noradrenaline metabolites to see how much stress are they under. We can see oxidative stress and actually get an oxidative stress marker on the body. We can also look at estrogen and progesterone. We can see testosterone and DHEA. We can see is some of that testosterone actually being converted into estrogen through a pathway known as aromatase, as that's an important pathway to look at. We can see whether you are someone who is more catabolic. So what can happen is if you're going through a really stressful period of your life, cortisol actually causes that brain shrinkage. You don't want to be exposed to cortisol for any length of time. You might be going through a really stressful period, and initially what happens is your body will actually increase DHEA production to match it, because DHEA is anabolic, it's pro-growth, cortisol is breaking down, is catabolic. So we can actually see, where are you on that curve? Are you someone that has a really high stress demand at the moment, but you're coping with it? Or are you someone that's now exceeded that capacity, and now the ratio of DHEA to cortisol is off balance, and we can see that you're becoming more catabolic? Sometimes what I'll see is that actually you're not producing, you might be producing enough cortisol, but there isn't enough freely available to you. And what the body is doing is trying to protect you. And this can cause very low levels in the cortisol awakening response. And so, clients say to me, oh, I'm trying so hard. I know that I've got to be really good and I've got to get out of bed and start my day, and I really want to perform at the highest level, but actually their cortisol is tanked so low that them trying to get out of bed is just a mission in itself. And so the Dutch test is a really good way of seeing what these are. But as I say, cortisol needs to be managed because it can damage neurons. And initially it's designed to be there because it's anti-inflammatory. When adrenaline and noradrenaline go up, cortisol is moderating the pain that you feel. It's you don't feel it because ideally it was designed for that fight or flight. It just isn't designed as a very long-term stress strategy. And then pregnenolone, which is made in the adrenals and also from cholesterol, supports your memory and is neuroprotective. And a lot of the sex hormones actually come from pregnenolone at the top. And as I say, DHEA supports you in response to stress. So we just want to make sure that if you're under stress, you've got enough DHEA to support you. And you can look at that ratio. And then sleep-wise is the biggest thing, as I say, for cellular cleansing. It's really, really important. Now, the space between the brain cells, that extracellular space, actually expands, and this just happens when you sleep. And that's why it's so important, because now you can actually clean that system and go in and effectively clean the kitchen after the dinner party. And this allows these magnesium ions, which are so important, that so many people are deficient in, and calcium ions to flow through and help with this activity. And it will basically flush out the debris, including amyloid plaques, and just keep the brain clean and functioning really well. And it reduces the formation of amyloid in the first place. So sleep is really important. It's definitely not the thing when you're busy that you want to be skimping on. Fasting improves insulin sensitivity. Obviously, we went over that last week. So fasting is one mechanism you can use. Regularly depleting muscle glycogen is another one. So exercising. I always like, and you've seen it in the program, going out for an early morning walk or doing some yoga when it's dark, just to get the body moving in that fasted state is really good. But then doing something that's higher intensity, like weight training or a cardio session or a HIIT session a few times a week, which just improves insulin sensitivity and depletes muscle glycogen. You don't need to fast and do that intensity workout. You just pick one, for example, on a day, but fasting overnight 12 hours is going to be important. So that again, and we want to be improving insulin sensitivity if we want to protect ourselves from dementia, but we also want to stay really fit and lean and healthy. When you're fasting, you're enhancing autophagy, which is this cellular recycling, and includes things like damaged mitochondria and these misfolded proteins. The other thing is that when you're sleeping, it's increasing growth hormone, which repairs new cells. That helps with new brain cells as well. So really important. Also, when you're sleeping at night, for you to produce enough growth hormone, you don't want insulin to be present. So that's why I always say try and have your last meal 3 hours away from bedtime. And what that will also do is help another hormone known as adenopectin to be released, which can actually help with fat burning as well. And you want to be in this more fat burning state overnight. Sleep apnea is something that you do want to speak about. I did a good podcast maybe almost 2 years ago, I'd say, with Dr. Jay Corsandi, where we talked about this in detail. It is fixable, so you can look that up. It's an older podcast, really good one. He's called the Sleep Biohacker on Instagram, and he talks about sleep apnea in it, but it inhibits deep sleep. So if you or your partner has sleep apnea, it's worth looking at. Whoop are probably better at this than Aura, to be honest, for picking it up. So I've seen clients that are wearing a Whoop strap, for example, they might have 30 wake-ups in a night. And then that's a lot of wake-ups that they're unaware of. And in that scenario, you'd definitely be sending them to go and see somebody about possible sleep apnea. You want to be breathing nasally at night, because if you're breathing nasally, the brain is going to be releasing nitric oxide, and nitric oxide production helps to lower blood pressure and keep the blood vessels open. So it's really important. So you can train yourself to breathe nasally. The podcast that I've done with Patrick McEwen are good for this, and he talks about mouth taping. But even just practicing during your day, because we so commonly become mouth breathers, particularly when we're stressed, is useful. And one thing you can do is when you're going out and you're trying to elevate your heart rate a little bit, and you're doing a brisk walk or you're doing a gentle jog, then trying to breathe nasally for as long as you can is going to be really good, and you can train that system, and hopefully you do more of it at night as well. The other thing is leaky gut, because this allows things to come through that shouldn't be coming through. There is a very, I would say, inconclusive theory around whether or not gluten affects the brain. If you were to read Grain Brain by Dr. David Perlmutter, he would absolutely say that gluten does. If you look at Lisa Mosconi's work, it seems inconclusive. One thing that is fairly conclusive is that gluten can cause leaky gut for many people, even if they're not got celiac. So what I would say with gluten is you really want to not be exposing yourself to it too often if you can. And that doesn't mean going for gluten-free options, because generally they're more processed. than things that have gluten in it. But just be aware that we now seem to be food manufacturers, and I say we, food manufacturers are actually adding gluten into a lot of things because it's a protein that can help to extend shelf life and make it taste more doughy and more yummy. It can contribute to inflammation, and you've got these tight junctions like this in your gut lining, and in leaky gut they just kind of come away slightly. Practitioners used to look at zonulin to see on a gut test whether that identified if zonulin was high, whether that identified leaky gut. It seems a less accurate measure now to look at. But those tight junctions can be damaged from things like pesticides. Again, you'll see your pesticide sensitivity on the report. From gluten sensitivity, alcohol can do this, sugar can do this, particularly in excess, and processed foods and preservatives, and so can stress. So stress has an impact as well. And remember, if you're optimizing sleep and you're optimizing that growth hormone production, you'll be a long way for optimizing the gut repair that you're getting, because growth hormone actually repairs the gut lining. And the research that I've seen suggests that you actually renew that gut lining every 10 days in its entirety. So remember, it's like only one cell layer really thick. So it gets renewed regularly and often, and you want that. Having things like collagen, bone broth, taking colostrum, really good, glycine, glutamine, all these things really, really help you gelatin with your gut. And then certain medications can cause damage as well. Or if you have food intolerances, it's always worth getting them checked out, because if you've got leaky gut, it can create systemic inflammation, because now you've got things that shouldn't be crossing that permeable wall that are. It should be just the vitamins and minerals and the micronutrients crossing, not food particles. And then this can cause inflammation and has been linked with autoimmunity. The blood-brain barrier has its own barrier. In terms of things, you can get a leaky blood-brain barrier, so that's important as well. And they have found things like bacteria and viruses and fungi and other microbes in the brains of Alzheimer's patients. So it looks like things are crossing. Epstein-Barr virus is one that has been linked. There are other ones that seem to impact the brain. But you really want to do everything you can really to keep that gut-brain axis well supported, to enhance vagal nerve tone with things like yoga, breath work, meditation, cold showering, and really just try to optimize and think that, the yin and the yang of yoga is the best way to sum it up. You always want to be pushing, relaxing, pushing, relaxing. That's how life should be, this ebb and flow. And that's how your body really likes to respond. So I find that most people don't put in enough recovery time, including myself. They just kind of go, 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 go. So if you can be thinking, maybe I can step back a bit, less is often more, and actually it will enhance your productivity and your performance in everything you do. So excess weight does predispose you to a greater risk of cognitive decline. So you want to be looking at that. Waist size wise, if you are exceeding these measurements here, then you definitely want to be looking at reducing your weight. And a good way to do that initially, if you have got a lot of weight to lose, actually is through that zone 2 cardio that we were talking about, doing lots and lots more movement. People who walk 15,000 steps a day, between 15,000 and 20,000 steps, actually lose weight very, very quickly, and they lose body fat because they're in that fat burning zone. Cold exposure increased to 5 minutes a day, 10 minutes, it has a big effect. So if you increase your movement to 15,000, 20,000 steps, and you then go in a fasted state and get in a cold shower for 5 minutes, and you'd work up to that. I'm not suggesting you go in cold straight away. You can do like cycling of hot, cold, until you really just build up that tolerance. I was speaking to a client who decided to put on their favorite song, got to 3.5 minutes just doing that. You can really, really enhance brown fat, which has more mitochondria, and enhance this fat burning and help to get weight off. And then you can also include the strength training and things that we're looking at. Exercise wise, if you're doing high intensity activity, which is amazing for your health as well, you just want to try, and if you've already got a very, very high stress load and you're overweight, that wouldn't be my first place to look, is high intensity activity. If you're in perimenopause, menopause category, you've got a high stress load, it wouldn't necessarily be. You would want to do 1 or 2 workouts like that a week, but you want to keep the length, the duration of those workouts down. So by the time, if you're keeping like a really intense workout, sub 30 minutes, you're not going to be elevating cortisol so much. And one thing I would say to you that I really think I would encourage all of you to do is you want to go hard or go home, right? It's important. If you're doing a workout, you're working out, so go hard. But when you finish the workout, just give yourself 2 minutes of relaxation. And you could do this in multiple ways. You can just stand there with your palms facing outwards and do box breathing for 2 minutes. 4 in, hold for 4, 4 out, hold for 4 in. What that's doing is you just pushed yourself into a really highly sympathetic state. Now you just need to release it all and bring you back into a parasympathetic state. So actually help your body to go through these cycles and relax. You can lie there and do like a meditation. You can think about gratitude at that point. You can put your legs up against the wall. That's really helpful for things like vagal nerve activity. But do something for 2 minutes that actually doesn't just drop your heart rate back down, but brings you mentally and just lowers this cortisol response so that you feel calmer. That will go a long way. So go hard, yes, but then make sure you moderate by relaxing afterwards. This is a really good book by Dale Bredesen. We'll talk about the hormones separately. The XX Brain by Lisa McConey is better for that. Cyrex is array testing you can do, but Genova also do some really good testing now on intolerance testing. If you're looking to see like organic acids, whether they've built up, the Dutch test does some that I told you in terms of B vitamins, but you can also look at the metabolomics or the Nutrival. Metabolomics, since this is available in North America as well. The Nutrival requires centrifuging. A lot of what is done on that test can now be done on the metabolics test with a combination of urine and blood spot testing. So because of the limitations with COVID and everyone being in lockdown, they developed the ability to do it at distance. And so if you're interested in any of those tests, you can just reach out to us if you want to look at them. But that concludes on the hour my presentation. I think we did just manage to get it in. I know that is a lot of information for everyone. And so hopefully I haven't kind of bombarded you with too much there. I think someone's got a connectivity problem. But does anyone have, we are going to, as I say, look at female health separately on this and hormones. But we have got our coaching call on Wednesday. Does anyone have any questions in relation to what I've shared there?
Hi, Angela.
Hi, Marina.
I'm really sorry. It might be a stupid question, but I've got I have got a tumor that is to do with the growth hormone on the adrenal gland. I think it's the adrenal gland, isn't it? And they didn't want to remove it. So if you're talking about all these things and increasing some growth hormone, will that not be a risk for me?
What we're talking about is things that would just naturally optimize the production of it. So you'd never want to take growth hormone.
No.
And you'd need to speak to your medical doctor about that. But we do.
I have got excess there, but it's stunted there, if you know what I mean.
Yeah. So it would be hard to say that by you sleeping and letting your body naturally produce what it needs, that would be aggravating it. Do you know what I mean? What we're not doing is telling you here to take anything. And there are distinct problems with people like bodybuilders, for example, who take growth hormone and the impact on longevity. So after the age of about 40, most of the growth hormone we make is in our sleep, because as children we make an abundance of it, but less so. But we do need some, because we don't want too much, because then it's stimulating that growth pathway and it's stimulating mTOR too much. But then so is a high carbohydrate diet, so is insulin resistance. So what we want to be doing is just optimizing it so that we're getting enough, so that our body's doing all of the repair work that we want it to. But in relation to your like specific things, that would be a medical question really that you need to speak to your doctor about. But
Mm.
all the things that I'm talking about here are health enhancing and actually helping to engage your parasympathetic nervous system. Because really what I want you to take away from that is, in terms of optimizing adrenal function, it is this yin and the yang, it is the push and the pull of getting this balance right in the body that we need to understand. And so, you know, even this is a slightly separate point, but even, for example, if you're going through a highly stressed period in your life, it isn't the right time. There's seasons in life to be doing 24-hour fasts, high intensity classes 3 times, 4 times a week, and pushing and gunning. It's actually the time to think, well, maybe I need to dial things back a bit. Maybe I need to be supporting myself, do more parasympathetic activities, which is why I say we'll do a session on stress separately. But you want to think of this bucket that you have, and you can't just keep filling it and filling it and filling it. You've got to have things that are countering that response and building in recovery cycles, not just people think about recovery cycles across the year. They think, well, I'll go on holiday or I'll have a weekend off. I want you to think about them in terms of intraday, like at what points in your day, like I was talking about, the end of a workout, you've been in a highly sympathetic state. How can you dial that back now and re-engage that parasympathetic system? How can you take a break, you know, go for a walk, just step outside, even into the garden post lunch, have 5 minutes, breathe, you know, actually sit down and enjoy a cup of tea or coffee rather than running around trying to do everything with the kids, just to sort of relieve that constant stress, because it is relentless at the moment that everyone's experiencing, and more so the last 2 years. But I don't think any of those things that we're talking about here would be adding to the problem that you have. If anything, health enhancing.
Okay, thank you.
No problems. Does anyone else have another question? We've got time for one more question before I go. How important? Why can I not see this properly? Hold on, in the chat. For magnesium, there's different sources, like leafy greens have some magnesium as well. Sharmina, I don't know if I've circulated. Have I circulated a list with the main sources of nutrients for different foods for different nutrients? Have I done that? If not, I'll circulate it. Let me make a note, because I think that will make it easier for you. Seeds also contain them. I think I have, but I can circulate it again. Arsenic is associated with rice, actually, quite a lot. Can GP do all these tests? No, these are functional lab testings. They're looking more behind the scenes. The blood ones they can, in terms of looking at the simple B vitamins and looking at like they can look at things like cholesterol, for example, LDL, HDL, which we've done in a separate presentation and will repeat again for those of you that are new. They can look at all of that. But some of these, what I'm looking at, are more like functional metabolites. They can look at hormones and they can look at blood levels and then prescribe hormones off the back of it. What we're looking at is from a functional perspective, what's building up in the body and how can we moderate that. Mouth taping. Okay, the mouth taping you had this morning.
Yeah, I saw it this morning.
And leaky gut. So the things that that can help you heal leaky gut is taking collagen, bone broth. I'll put them in the chat here. Colostrum, I have had great results with as well. You can take that. Glycine, glutamine. There's lots of different amino acids that will do it as well, but you get a lot of that from things like bone broth. But colostrum is really helpful as well. How important is oxygen therapy in longevity by your standard? Oxygen therapy, are you talking about hyperbaric oxygen? That is looking amazing in terms of enhancing longevity. Yeah, amazing. And you can actually get HBOT in your home now. If it's within your budget, it's looking really good. But when we're talking about breath work here, we're talking more about the exchange between oxygen and carbon dioxide, and that respiratory exchange ratio, and that's enhanced better through nasal breathing. But HBOT is really good. And to be honest, I went to a clinic, it was just before lockdown, and had a whole set of vitamin IV infusions with glutathione. I had lasers into my blood, blue lasers for like antibacterial lasers, coupled with different types of ones actually, and antiviral in the form of green, and then he had red light therapy in it. And then I went in the HBOT chamber for 45 minutes and did a red light therapy session. And I came out, I have to say, feeling amazing. But yeah, hyperbaric oxygen is really, really good. So if it's within your budget or you've got a clinic where you can do it, then yeah, there's a really good way of getting oxygen into your cells. So thank you everyone for coming to today's session. That was probably, I would say, the most technical of presentations that we do on this program. So all like that at all. But it is just, I just really want to give you the up-to-date research that's coming out and allow you to think about lifestyle modifications that you can make, really. I would say if you take away anything from this presentation, it goes back to what we were saying last week in terms of body composition. Metabolic flexibility is king. So the more that you can optimize your metabolic flexibility and optimize your blood sugar control, lower inflammation, eating from the green food list that we've given you will really help you to do that. Optimizing your movement, lowering stress. These are all things that are really, and really dialing in your sleep, that are going to like pay off huge dividends in the long run for you. So those are, you know, yes, it's a complicated bit of presentation, but if you can optimize those things, you'll be hitting the key pillars. And the other thing that I hadn't put on there is curcumin has been showing some really strong promise as well for actually sloughing off the amyloid plaque. So if you are someone who's a bit more risk, then taking a curcumin based supplement can help you as well. So but it's exciting things. There's more things coming out all the time. I must dash, but it's lovely to see you all. I will see you again on Wednesday's call, and have a lovely evening, everyone.
Thank you, Angela.
Thank you, Angela.
Pleasure.
Thank
Take
you.
care, everyone.
Bye.
See you soon.
Bye.